Hello. Obsessive compulsive disorder and obsessive compulsive personality disorder have similar traits and sound very similar. However, the difference between the two is greater than the names would suggest. They are two distinct clinical entities with different characteristics. In ICD-10, obsessive compulsive disorder comes under the section of neurotic, stress-related and somatoform disorders, whilst obsessive compulsive personality disorder comes under the heading of personality disorders. In ICD-10, obsessive compulsive personality disorder is actually termed anankastic personality disorder, and this helps decrease the confusion between the two. From now on, I'm going to use the abbreviated term OCD for obsessive compulsive disorder, and I'm going to use anankastic personality disorder instead of obsessive compulsive personality disorder. I'm Dr Beth Colby, a psychiatrist in London. In this video, I'm going to outline what OCD and anankastic personality disorder are, and then I'm going to describe some of the differences between the two disorders. Some people may actually have both disorders simultaneously, and people with OCD may have some of the traits of anankastic personality disorder. Right, on to OCD. People with OCD experience obsessions or compulsions, or may experience both of them. These interfere with somebody's everyday life and their ability to function. Obsessions are irrational thoughts, ideas or images that constantly repeat in somebody's head, and compulsions are ritualistic behaviours that somebody constantly repeats. Obsessions aren't just worries about everyday problems. They are irrational thoughts, ideas or images that won't go away. They're unwanted and cause a lot of distress to the person experiencing them. People know that they're their own thoughts but find it almost impossible to control them. And these thoughts may lead to actions to actively dispel the thoughts, such as engaging in compulsive behaviours as a means of distraction. Compulsions are irrational and often ritualistic behaviours that somebody feels compelled to do and has to do again and again and again, such as cleaning, hand washing, counting, tapping, or double checking things. People engage in these repetitive behaviours for fear that something dreadful will happen if they don't. They may do this to expel the anxiety of an obsessional thought, such as the fear of somebody dying. These repetitive behaviours are seen as irrational, but people find them very difficult to stop doing them. Anankastic personality disorder is a personality disorder characterised by the following: excessive doubt and caution, preoccupation with details, rules, lists, order, organisation or schedule, perfectionism that interferes with task completion, excessive conscientiousness, scrupulousness, and undue preoccupation with productivity to the exclusion of pleasure and interpersonal relationships, excessive pedantry and adherence to social conventions, rigidity and stubbornness, unreasonable insistence by the patient that others submit to exactly his or her way of doing things, or unreasonable reluctance to allow others to do things, intrusion of insistent and unwelcome thoughts or impulses. Now I'll go on to differentiating between the two different conditions. First of all, by the disorder type. Obsessional compulsive disorder is an anxiety disorder, and the compulsions are done to decrease the anxiety that the obsessions cause. So with OCD, the compulsions like checking, counting, washing are performed to reduce anxiety, and the symptoms tend to fluctuate with the underlying anxiety of the person. So for instance, somebody might have the obsession that their kids might die by being gassed, or the house is going to burn down because of the gas cooker. So the person might check and check and check again. The gas cooker is turned off, and they may go out and wonder, oh, is it turned off, and have to come back and check it, and it's off, then go out again. So all this coming back and forth and checking the oven is to dispel the anxiety of the thought that their kids might die or the house might be burnt down. The behaviours of anankastic personality disorder are stable over time, and they are unrelated to any anxiety. And somebody with anankastic personality disorder does their behaviours in order to be comprehensive and efficient, and the actions are performed to reach perfection, not to ease anxiety, as in OCD. As regards insight, people with OCD have insight into their disorder. They're aware that their thoughts are irrational, and the behaviours that they have to repeat again and again and again are abnormal. People with anankastic personality disorder do not have insight into their disorder. They're able to control their thoughts and behaviours, which aren't linked to anxiety. And the rigid procedures that they adhere to in doing everyday tasks, they think are the only way to do things and the right and proper way. As regards impact on life, people with OCD are very distressed by the nature of their behaviours or thoughts, however much they're able to control them. It affects all parts of somebody's life, including their work, and they feel personally affected by their disorder. It doesn't affect their ability to have empathy, and nor affect people's personal relationships. Individuals can often feel guilty about their behaviours, and they may, for instance, ask that somebody takes their shoes off when they enter the house because of fear of contamination. And people with OCD often seek professional help to overcome the irrational nature of their behaviour and the anxiety that they experience. In contrast, people with anankastic personality disorder fully believe that their actions have an aim and a purpose. They tend to be very good employees as long as interpersonal relationships are not involved, and they do not believe that they need any help or treatment. They're not bothered by their disorder or even aware that they have one. Anankastic personality disorder drastically impacts interpersonal relationships to their detriment. They're very difficult people to live with and lack empathy for others. They think that others should conform to their methods of doing things, and they believe that other people would be better off for doing things their way. They do not seek help because they don't see that anything that they're doing is particularly abnormal or irrational. Finally, regarding time, the time it takes for people with OCD to perform all the rituals to neutralise the obsessions can be quite large. So, for instance, all that cleaning every day, or washing hands, or checking the gas cooker. At the end of the day, somebody with OCD may regret all the time that they've done doing their ritualistic behaviours. Having an anankastic personality is part of the individual themselves, so it does not take up any extra time, as it's related to the whole way that the person lives. Rather than being an activity in itself, doing things to a perfectionist standard is more of a trait rather than a time-consuming activity. So to summarise then, we've talked about OCD or Obsessive Compulsive Disorder, and anankastic personality disorder or obsessive compulsive personality disorder, that although the terms sound similar, they're actually two very different conditions.